Right. So Keterolac is the next one up. It's not found in the textbook in its own category. So it's an NSAID. It's the most powerful NSAID. Think powerful. This one is the most powerful NSAID. It's as powerful as an opioid. It just happens to be an NSAID. It's acute pain to moderate severe intensity. Remember that, acute pain to moderate severe intensity. It would be used for post-op. Think of those patients that are allergic to morphine sulfate and they need an alternative. The main thing to note is this is a big thing to remember. Do not exceed more than 5 days for Keterolac. Don't exceed that number, okay? And the adverse effects are your classic NSAID adverse effects, like your peptic ulcers, your GI bleedings, your prolonged bleeding. Other ones to consider is suppression of contractions, which you would think of, the suppression of contractions happen with also morphine sulfate actually, but then this one is, Keterolac also does this. And premature ductus arteriosus, which is very interesting because this one is, you want to think about those pregnant patients for this semester, for third semester nursing. All right, premature ductus arteriosus and the suppression of contractions if you're trying to have it for, so it's really contraindicated to not be used for labor and delivery purposes, okay? So contraindications, do not use with other NSAIDs because you're making it more at risk for this bleeding, this peptic ulcer risk. If you have a GI bleed history and you're at risk for it, it would not be advised to use this. Your advanced renal failure, you would have to do. And also your labor and delivery, you don't want to use it for. You don't want to use it for also confirmed intracranial bleeding. So anything that's associated with bleeding inside your body is very dangerous, okay? And use prior to surgery. Why do you not want to use it prior to surgery? You don't want to use it prior to surgery because prior to surgery, you're going to create those incisions and it's going to prolong that bleeding, and so it's a high risk. So you're going to use it post-op, not before the surgery pain, okay? Teach those patients to report if they see bloody stools because that indicates something is wrong with your body and there may be an internal bleed. Abdominal pain, if there may be that peptic ulcer there, that may be a sign. Avoid and teach them to avoid those aspirins because that's going to just increase that risk, and alcohol as well. And you want to monitor periodically for that pain and assess to make sure that the Keterolac is working, okay, for that patient. So the administration for Keterolac is an IM and an IV. The IV begins within 30 minutes. It will peak at 1 to 2 hours, and it will last for prolonged to about 4 to 6 hours in length, which is and if you have renal impairment, it's going to prolong that because it excretes through the kidneys, okay? So the ceiling dose I found on the internet, now I'm not sure if every source is the same, but 40 milligrams is what I found as, so that would, it makes sense because you want to think of Keterolac as your stronger drug, so a lower number of your ceiling dose, because all NSAIDs have a ceiling dose. Like for instance, your acetaminophen is 4,000 milligrams, or your ibuprofen is 3,200 milligrams, okay? And also, the main thing to know is watch for, because we know how we said that it would be contraindicated for renal failure, it can cause renal failure, and it's prolonged in renal impairment patients. So obtain those renal and hepatic baselines prior to therapy. That's everything you need to know for Keterolac. Remember, don't exceed more than 5 days, guys.